The staffing crisis in healthcare was made abundantly clear this week when one Ontario hospital said it would be forced to close its ER for lack of staff. After years of strain plus pandemic stress, staffing has reached a critical level in healthcare. Angela Stanley is president and CEO of Wellington Health Care Alliance. And Angela, thank you for being with us.
Thank you for having me.
And it was your decision, among others, I'm sure, to close this ER overnight on weekends. How difficult is that in the context of the services you provide to say we can't provide the care that we need to?
Extremely difficult. It was a decision not made just by me, but of course I own it. But with the gaps we saw in our service or in our schedule for nurses, recognizing the risks of understaffing, we made the very difficult decision to close for the weekend over the evening and night shift.
We, Angela, feel a little bit as though this has been a slow-moving problem. Obviously, pandemic and the strain that put on the humans involved in the work during the pandemic made it worse. We had a staffing issue before. How do we solve it? What would you like to see happen that gets more nurses trained, more doctors in your hospitals?
Few things. I think we need to look at how we're training clinicians, particularly for rural settings. They're very much generalists, so how we are training is something that we need to strongly look at. But we also need to support their onboarding. They are required to do a lot of things on shifts, sometimes, delivering a baby and managing an MBC all on one shift. And that takes time, and that takes exposure, and that takes mentoring to grow those skills. And we need some stability, I would say, immediately for that. The other thing I would say is we also need to look at who's doing what. So is there opportunity to review clinical allocations? So can nurse practitioners be utilized more so in primary care? Our primary care physicians do everything at our hospital, along with looking after people in their own practice. And so they are stretched just as much as our nurses are.
Longer term, would more people be attracted to this profession if some key changes were made? I'm thinking about the length of the shifts, the hours to work, the pay. Are those things that we need to take a harder look at?
I think we need to look at everything, to be quite honest with you. I think, we have the system that we've designed for the last 25 years. It's not working for us anymore. So I would say there's plans, there's other systems that we can look at and learn from, but I would say everything should be on the table at this point in time.
One thing on the table for the premiers is more money or a share of the spend by the federal government. Is money the answer, Angela, or is it doing different things with what we have?
I think it's actually a combination. If we're looking at fundamental system transformation, you have to fund the transition safely. So we have to maintain one of our system that we currently have while we're building new. So I think there is a component of money that is necessary to bridge that transition. But I think fundamentally, it's a complete redesign of the system.
When do you see this hospital reopening again on overnight on weekends? When is this issue behind you?
So I can't guarantee that it won't happen again. There's closures happening around all southwestern Ontario over the summer for small rural hospitals, but for us, we have intentions of reopening on Monday morning.
Angela, so good to have you with us. Appreciate your time.
And thanks for having me.
Angela Stanley is president and CEO of Wellington Health Care Alliance. Time for the takeaway and a reminder about how privilege carries responsibility. The total system failure by Rogers Communications has prompted outrage from customers who found themselves utterly cut off in a world where connection is no longer a nice to have, and from businesses which couldn't perform basic transactions to allow them to operate, to government, which is demanding some answers of the how and why variety. If there's a silver lining from the massive failure of Rogers systems, it's that we may see some national network cooperation in future so that customers aren't left hanging by any one network and instead can hop onto a rival system while the outage is worked out. Sounds like a good plan in theory, though the practicalities of it may be more complex. But the truth is, we have a country dominated by 3 large networks. Any talk of competition is really about letting other businesses buy space on those networks. We long ago struck a deal. In exchange for the limited public airwaves, a few players have the right and duty to provide telecom services. Building a national wireless or wireline network is expensive and time-consuming, and Canadians are usually well served by ours, even if we feel the pricing of those services may leave something to be desired. But what was once a luxury is now a necessity, and the duty to provide it has become one you might equate with electricity or water. What's the best way to safeguard against future system outages? It may be that more regulatory oversight is needed. It is true that regulators often lack the technical knowledge to make themselves useful, but that's fixable. My takeaway? Making sure a major systems outage doesn't happen again is in the interest of all Canadians, as well as the companies involved, so that something good comes out of a bad situation. In other words, let's use Rogers lemons to make some lemonade. That's Taking Stock for this week. I'm Amanda Lang. Thanks for being with us.